Hi, my name is Dr. Farial Luhar. I'm a naturopathic doctor, and today I just wanted to speak to all the lovely ladies out there. If you are a woman who's been experiencing painful menstruation, irregular periods, or periods that are quite debilitating, where you may have PMS symptoms such as headaches, crampy periods, heavy periods, breast tenderness, acne, mood swings, irritability, and lots of fatigue, then this may be very interesting for you to take a listen to, because most women who have difficult periods or who have some of these symptoms such as acne, when they go to see their GPs, will be placed on birth control pills, oral contraceptive pills, not for the purpose of obviously preventing pregnancy, but more so to treat the acne or to treat some of these symptoms related to uncomfortable and painful periods, or to regulate the menstrual cycle. Naturopathic medicine believes that we need to look at the root cause of why these symptoms are occurring in the first place. And so usually these symptoms are happening for two reasons. One reason is the inflammatory process. There may be lots of inflammation in the body that also takes into consideration poor gut health, poor ability to detox some of these toxins that we are exposed to from our diet, from the environment, from cosmetics and other products we put onto our hair and our skin, but also the ability of the digestive system to be able to package up unused hormones or hormones that have already been used up and create byproducts to be able to get them out of the system. The other issue is a hormonal imbalance, and in most cases, women who are dealing with very, very painful periods that are causing lots of clots or fibroids or ovarian cysts and so on can be suffering from what we call estrogen dominance. So it's high levels of estrogen relative to progesterone. Now, getting tested is important. It's important to know what your hormones look like in the two different phases of the cycle. The first phase, which is called the follicular phase, where estrogen is typically the dominant hormone. And then the second phase, which is the luteal phase, after ovulation, where progesterone is going to be the dominant hormone, preparing the lining of the uterus for implantation. If an egg has been fertilized, if the egg has not been fertilized, then that lining is going to shed, and that leads to what we call the period, where we have the shedding of the lining of the uterus. So if you're a woman who's experiencing very difficult PMS symptoms, or an extreme version known as PMDD, premenstrual dysphoric disorder, this is similar to PMS, but it is a lot more severe in its presentation, in particular with respect to the mental, emotional, and psychological aspects. So for example, a woman who suffers from PMS mentally and emotionally may have low mood, may be feeling a little bit off, may be feeling sad a day or two leading into the period and in that first week of the period. But for a woman who suffers from PMDD, these symptoms are much more pronounced, and she might be having lots of anxiety. She may not just be sad, she may be very depressed, may have crying spells where she's just crying and emotional for no reason. She could also be highly irritable and angry or even enraged. So it's really important to also identify which symptom spectrum perhaps you are experiencing, and also other related issues such as, like I said, irregular periods, missing periods, which are very, very important because the period is actually considered a fifth vital sign. So in order to understand if you're having an imbalance with your hormones, I like to use testing outside of just the typical blood testing, where we can look at hormones and saliva, and it gives us a lot more information. And it's from this kit. It's called the Dutch Plus. Hopefully you can read it. It is, left to right. But in any event, Dutch Plus stands for Dried Urine Testing for Comprehensive Hormones. Not only does it look at all the reproductive hormones, what's being produced in the body and how it's being used, and how it's actually being detoxed, but it also looks at the stress hormone profile and cortisol. So I would recommend that women consider getting this test done because it's really insightful and it's going to inform treatment. And then when we talk about treatment, there are many things one can do. Obviously, looking at the diet, ensuring that it's got high quality fats, healthy fats, your omega-3s, protein, fiber coming from vegetables and fruits, eating more vegetables such as your broccoli, cauliflower, liver-friendly foods such as arugula or kale, or dandelion greens. You can also opt to take in some of these in medication format where we can give natural medicines, supplementation, using certain types of herbs and botanicals. And of course, we can also address this through ensuring that you get proper movement, good sleep, and making sure that your detox pathways are working well. So those are just some things that we can do. I will discuss more about this in later videos, but I wanted to just help you to appreciate that if you are being placed on the birth control pill to deal with your menstrual symptoms and or acne, or other issues unrelated to actually preventing a pregnancy for using it for contraception, unfortunately, the birth control pill, while it may work temporarily, does come with side effects, and it also does not treat the root cause. It is just masking those symptoms. So I'll be discussing this a lot more in the future, but I wanted to highlight that we can address all of these issues using naturopathic medicine by addressing the actual root underlying imbalances and balancing out the hormones to deal with these symptoms. So if you're somebody that's curious about this, please get in touch.